This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Welcome to another episode of The Wider View, a set of special episodes of Sg2 Perspectives podcast. I'm your host for today, Jayme Zage, and I wanted to spend some time talking about a topic that we spent the last year covering in a lot of depth, and that is ambulatory surgery centers. We want to explore operational considerations that are going to have an impact on the success of how you implement that ambulatory surgery center strategy. To provide those insights today, I've asked two of our colleagues from the Spend Management business unit at Vizient, Brooke Beltran, the Vice President and General Manager, and Alan Passarello, a Vice President and Category Manager, to join Tony Guth, an ASC expert at Sg2, and myself as guests on this episode. Thank you for coming and being a part of this today. Let's start with you, Tony. Set the stage for everyone on why a strategy for ASCs is so important and why ASCs are so important for strategy planning for health systems today.
ASCs are important for most of our health system members at Sg2 because most of our health system members are still very hospital-centric. And the problem with that is the pressure is getting bigger and bigger. And a lot of our members are struggling to keep up with these pressures. It's leaving a lot of space for the competition who maybe aren't burdened with maintaining a hospital to take some of that market share. And this is especially relevant now because you see CMS resuming the phase out of the inpatient only list. And at the same time, it's expanding the ASC covered procedures list, including cardiovascular procedures like EP ablations, which is what we expected to see there. But it's a big deal. It's something that is very different than what we were seeing on the ASC covered procedures list years ago. This two-pronged approach lowers the regulatory barriers for shifting high-value surgical cases into ambulatory settings, which means more and more of the scope of what hospital-based health systems, most of our members at Sg2, a lot of that is threatened by competition that does well at doing cases outside the four walls of the hospital. So it's really important for our members to hold on to things like surgery that generate a good margin because it helps subsidize the broader hospital cost structure. It underwrites the entire high cost chassis. It's something else that we're working on, trying to make sure we're delivering care in an affordable fashion. So that's why it's especially relevant now, Jayme. These moves from CMS that we're seeing across different states, from payers or from different state legislatures, trying to get the ball rolling even further and moving surgical cases to lower cost settings.
Thank you, Tony. This is one of the things that many of those competitors understand is that ambulatory surgery center operations are very different and you can do them in a very different way. Not all of our hospital leaders understand all the nuances between that. Alan, start with some background on how operationally ASCs are different and how strategic planners need to work and think differently about planning for that ASC strategy that will help with achieving that ROI that they're looking for.
Happy to, Jayme. As more and more complicated cases move into that non-acute setting, the need for either improved operational efficiency, such as sterilization, occurs. We talk a lot about orthopedics in the non-acute space. And for those who may know that typically there are trays that are used with instrumentation and implants in them for cases. And there can be up to 7 trays, 10 trays a case that has to go through a steam sterilizer. And a lot of ASCs were not built to handle the complicated cases such as orthopedics. So therefore, they have to outsource that operation to a third party to manage, which is increase in overhead costs, or they have to add on to their facility and build out to actually create more room for a sterilization unit that satisfy their needs. As we talk about other procedures moving at outpatient setting like cardiology, historically, ASCs were used for arthroscopy cases and orthopedics and general surgery type cases where you use a lot of consumables or disposable supplies. Now you're reusing reusables. In addition, you're using higher end technology. So in cardiology, you'll need a higher technology CT scan versus what was used primarily as an entry level diagnostic procedure. Costs are going to continue to climb for these ASCs as they move those complicated cases out there. Looking at some of the other challenges in that outpatient setting is data visibility and financial performance based on these complicated cases and the lack of or decrease in reimbursement that freestanding ASCs receive versus HOPDs. And that can be of a concern for owners of ambulatory surgery centers or management of ambulatory surgery centers. So having good strategies associated with procurement and sourcing for good contracts for your implant is definitely needed.
Brooke, what are some of your thoughts that you might add to what strategy planners need to know about operations at ASCs?
Alan said it really well. First and foremost, it's just understanding the nuances of the ASC market compared to hospitals and the operational levers that drive performance. In my role at Vizient, I've had the opportunity to work with ASCs across the country and see firsthand leading practices that drive sustained success. And the general theme among high-performing ASCs is that they deploy systems and strategies that improve data visibility and drive the right purchasing behaviors and ensure strong integration between their materials, clinical, and financial systems. When these elements work together, the ASC can implement the operational and financial disciplines required to truly thrive. Data visibility is critical. ASCs must have material systems that provide precise transparency into spend, especially supplies, implants, and physician preference items. But equally important is the integration between clinical and material systems, which enable things like true case costing and accurate, up-to-date preference cards. When you have that level of insight, it allows providers to target cost reductions, manage variation, and fully understand the economics of each procedure.
That's great insight. You're talking about creating some standards that make the clinical care consistent and high quality, but also help to manage costs overall. Let's dig deeper into that approach to purchasing. There's a lot of different things to think about when we're talking about supplying to the ASC setting. And they don't have as much storage space. It's maybe not as complex of patients. What are some of the differences in purchasing and what are some of the things that they need to know about as they look to create that plan for how to ramp up the ASC volumes?
When planning things like ASC investments, I think strategic planners need to understand that the supply chain model is fundamentally different from the hospital environment. ASCs are running on tight margins. Every purchasing decision has a direct impact on profitability. And that makes discipline, what we call more mature supply chain practices, not just contracting, essential from day one. First, cost structure in ASC is primarily driven by supplies, implants, and physician preference items. Planners need visibility into those categories and a strategy to manage variation early. That goes back to the data insight comments that Alan and I touched on before. Standardization can create real value, but it requires physician engagement and a clear understanding of how product impacts case economics. The second thing is ASCs often have a different mix of vendors, lower volumes, and different distribution needs. And this is where supply chain maturity matters. Health systems must ensure that the ASC has the right partners and lead inventory practices that match its operating model. Simply transplanting hospital processes in the ASC doesn't work. They need to understand the nuances of the ASC market and adapt the right strategies to support those ASCs. And importantly, for ASCs that operate in partnership with the health system, which is primarily the types of clients that my team is supporting, strategic alignment is critical. When both parties are aligned on goals, purchasing strategy, and decision rights, the ASC could absolutely capitalize on the system scale when it makes sense. And whether that's contract pricing, distribution efficiencies, or things like standardized product categories, there's value in that, but it's only realized when the ASC's needs and workflow are respected and not necessarily overshadowed by hospital-driven processes.
Alan, do you have something you want to add to that?
One thing for strategic planners to look at is enabling technology. We know that there's challenges in that non-acute ambulatory surgery space with staffing. Margins are extremely tight, and making sure that you have the right technology that creates an ROI for your organization is extremely important. That may come in the form of an ERP system, which is more automated in fashion and has guided buying capabilities as opposed to manual entry into the system or managing your books on QuickBooks. There are applications out there where you have a three-way communication with your OR administrator, physician, and supplier when you're talking about those difficult cases like in orthopedics where they have to bring in multiple trays and sets. That communication is improving operational efficiencies and has a positive return, as well as documentation in your EMR system within the surgical case. Data in the non-acute space is very limited, and having good cost data aligned with quality data will enable specifically those freestanding ASCs to help them negotiate better payer contracts as they go forward. The reimbursement differences can be as great as 31% between a hospital outpatient physician department and a freestanding ASC. Enabling technology along with a good relationship with a GPO partner, as an example, or a contracting service. Oftentimes, ambulatory surgery center spend is relatively low compared to acute care hospital. So they lack the leverage to be able to negotiate strong supply contracts. Participating in a GPO can create aggregation of spend amongst multiple locations that must drive a better price point. And then also too, in the back end, depending on what you're looking at from a supply chain perspective, as far as what we call materials management or box moving, how are we coordinating the delivery of products and putting them away? The space constraints are really tight, and oftentimes suppliers are bringing in supplies just in time for the case as opposed to storing them on location. Good operational efficiencies is important to have as well.
Alan, you're talking a lot about freestanding ASCs. What about for those health systems that are moving into that ASC space? They're actually almost better positioned than to leverage their GPO relationships or the volume that they have. Or am I incorrect in that assumption?
You're absolutely right. Hospitals have the ability, one, to leverage the relationship with the GPO, again, because of the depth that they use the GPO partner for multiple contract categories of spend. Additionally, they also can offset some of the overhead costs associated with running an outpatient physician department or ambulatory surgery center. What we're seeing in the marketplace right now is many large health systems are now not opening up HOPDs, but are opening up freestanding ASCs. And that is the result of the changing in reimbursement, specifically around Medicare Advantage. They're requiring 20% of your patient volume to go to a freestanding ASC versus an HOPD. So we are partnering with large IDNs right now who are actually going out and investing in freestanding ASCs as opposed to expand their HOPD footprint. Additionally, there's a legislation that's going to be proposed, we feel, in 2026 with regards to site neutrality based on the geographical radius around an acute care hospital may limit reimbursement for those HOPDs. Another reason why hospitals are investing in that freestanding ASC market as well.
One additional point is, and you reference this around ASCs that are owned by or have a joint venture partnership with the health system, are they poised to benefit from that relationship? I agree with Alan in that there's absolute benefit in that. If an ASC is able to leverage the scale that comes with being a part of that health system. But I do want the audience to understand too that we have to understand the nuances of the ASC space. We've seen time and time again that hospitals or health systems that go out and try to say, we're going to just replicate the same strategy, deploy the same strategy that we're integrating for our hospitals into our ASCs. That doesn't work. Case in point is you see, and Alan's lived in this world as well, you may have a material system that the hospital is deploying or using, and it's great for the hospital. But when you get into the ASC setting, you need a system that's more nimble. We've seen the deployment of more ASC-centric material systems, and we've actually seen supplier partners that are selling clinical solutions, packaging these ASC material systems as part of their offering. It's not owned by that clinical company, but they realize the importance of having that tie-in and that integration between the clinical systems and material systems. I raised the point that we need to be thoughtful about the strategies and how they differ from the hospital, but there's absolute value in having that alignment where the ASCs can leverage the scale of that health system relationship.
How can the strategy team start to anticipate and manage those ASC challenges?
The top challenges that I've come across in my conversations with members lately come down to mostly health system members trying to get into the ASC space. They're paying attention to margins. Margins are not what they used to be in ASCs. They're tightening a little bit. They're remaining profitable. Data's hard to come by. But anesthesia is tough. Anesthesia costs are going up. The workforce shortages are a challenge that don't magically get solved when you start working in ASCs outside of the hospital. And reimbursement isn't exactly skyrocketing. So margins are getting squeezed pretty hard there. And site neutral shifts could further reduce payment for higher acuity services. Site neutral rate shifts could also further reduce payment here. So strategy teams need to keep an eye on these pressures, mile sustainability through Site 2 costs and reimbursement. But from the strategic direction, ASCs play a certain role for a lot of the health systems I've talked to. That role is largely decanting volume from the hospital so the hospital can be backfilled with hospital appropriate cases. ASCs are being asked to do more than what they were designed for The average ASC is still like a 1 or 2 OR ambulatory surgery center that is doing colonoscopies and cataracts. But moving forward, thanks to these CMS final rulings, they're enabling outpatient total joints, cardiac ablations, and a lot of these things are being done robotically. So many ASCs can't support the physical and clinical complexity of what we're expecting to be done in the near future. So they're too small for robotic platforms. They lack gel processing scale, and they don't have the PACU space for longer recoveries. So strategy teams need to assess whether their current ASC assets, if they have any, are future ready. Is it playing that strategic role the health system wants it to play? You don't want to be doing something in a hospital that your competition can do and that your payers are moving away from your hospital ORs. So if you're building a new de novo ASC, you need to make sure that it's going to be able to compete. Those are probably the biggest challenges, right? Paying attention to whether this is something that can be done financially sustainable, and we want to be able to make a margin, but also moving volume out of the hospital so we can backfill with something. It's those two primary challenges that come up most often in conversations with our clients.
Thanks, Chubby. Alan, from your perspective on the more implementation side with ASC leaders, how can the strategy team help them anticipate and manage some of those challenges in operating an ASC?
We talked a little bit about space already. And that being said, we also have inflationary costs that continue to occur, whether it's just through natural processes around inflation or whether it's through the tariffs. So it's becoming more difficult to manage the cost from the supply side. Specifically, as these more complicated procedures move out to the outpatient setting, implants are typically somewhere between 40 and 50% of the cost of the procedure. So having a good sound strategy and again, a good partner to go after and contract with those high cost devices can assist the ambulatory surgery center in managing their bottom line performance.
Brooke, how about you? What perspectives would you offer in terms of managing challenges in the ASC environment?
Many ASCs don't have the tools or resources to focus on supply chain activities, which make it difficult to identify savings and manage things like variation. Lean into those partnerships, lean into those relationships with the health system where the ASC is a joint venture. There's so much expertise that the health system has, either through the corporate supply chain team or through partners like Vizient. And ASCs that tend to be more high performing leverage those resources well to mitigate some of the staffing pressures that they're facing, as well as some of the rising supply costs that we touched on today.
Thank you all for your time and expertise. What's clear as I sum up is that what you do strategically well and operationally well in the hospital-based environment isn't necessarily translatable to the ASC. So you really, as you start to leverage this important side of care to drive your strategic growth, you need to understand the nuances, the differences in how to operate, manage supply chain, and manage the flow of supplies through the ASC environment to help to keep those costs down, to keep that variability down. So thank you, Alan and Brooke and Tony, for joining me today. And thank you, as always, to our listeners on Sg2 Perspectives. And thank you for joining this episode of The Wider View.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, Sg2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.